This is
Make It Plain.
MIP
With Masamela Matfumo.
Mark Thompson.
Make it plain.
Get woke.
Ladies and gentlemen, we're honored on Make It Plain today. We have a very special guest. We've seen her frequently on television, and she has been very important in all of the discussions in and around the pandemic. She is the founder of Advancing Health Equity, and its role has been to partner with healthcare and related organizations to confront racism in healthcare and to eradicate racial health inequities. In 2019, she was recognized by Forbes as one of 10 diversity and inclusion trailblazers you need to get familiar with. We've certainly gotten familiar with her during the course of this pandemic. We're honored to have with us Dr. Uche Blackstock with us. Dr. Blackstock, how are you?
I'm fine, Reverend Mark. Thank you for having me.
It's an honor to have you. So the latest news is there's a vaccine that is nearing approval for the immunocompromised, correct?
Right. So actually what it is that there will be an amendment to the Emergency Use Authorization for the current vaccines, Pfizer and Moderna, so that it can be used in patients who are immunocompromised.
Okay. Is there any more word? I know there's been some discussion, but any more updates on the possibility of a booster to either of the other three vaccines, Moderna, Pfizer, or Johnson & Johnson? Do you think it's going to be necessary?
So what I will say is that in order to make that decision, they need to study clinical data. They need to study people who have received those vaccines, see are they being infected? If they're being infected, are they developing severe disease? Are they being hospitalized and dying? We don't have all of that evidence yet. So right now, that third shot is being indicated for people who are immunocompromised, who their bodies are not able to develop an immune response. But for everyone else right now, so far what we're seeing with the vaccines, even with the Delta variant, is that they still are preventing the worst outcomes of COVID-19, severe disease, hospitalization, and death. And until they do otherwise, they are deemed effective.
I also think there have been some other new numbers that have come out speaking to the effectiveness of the three vaccines when it comes to this Delta variant, correct?
Right. Yeah. And so you may notice that with both Moderna and Pfizer, and even Johnson & Johnson, that the effectiveness has decreased, but it's not clinically significant, meaning that if you are vaccinated, you are still substantially more protected from getting sick than someone who is unvaccinated. So most vaccines, to get FDA approval, you need to be at least 50% effective. And so these vaccines are still 80, 90% effective, even against the Delta variant. So that's still significant.
So that's important. I want to talk about that for a minute, especially since, part of your expertise is dealing with some of the racial inequity. And let's face it, some of our people still have questions. So I still get questions. Well,
absolutely.
It's not FDA approved. It's emergency use. So talk to us about that distinction. And what you just said was enlightening to me. If they have over 50% effective rate, so at some point, will the big three be eligible for full approval?
Yeah, so hopefully we'll have Pfizer, which is the first vaccine that got emergency use authorization. Hopefully what we've been hearing is that it should get approval in a few weeks in September, full approval, which I know for a lot of people out there is important to them. But I want people to understand that even to get emergency use authorization, that those vaccines were studied in tens of thousands of people, and the clinical data reviewed with a fine-tooth comb. The only difference between emergency use and full approval is maybe a few more months of data. But what we know from vaccines is typically, most of the side effects happen within 60 days, which is why for adults, they were followed up to 60 days before you could get emergency use authorization.
More MIP after this message. Are you finding that some of the initial skepticism in the Black community has waned and that more people are feeling comfortable about becoming vaccinated?
Yeah, I think there is a subset of people who were kind of, were on the fence, and they just wanted to see a few people around them get the vaccine, see that they were okay, that they didn't have any untoward side effects, and then they were willing to get the vaccine. I think a lot of people still have questions, right? These questions about emergency use authorization, full FDA approval. And so that's why you and I are talking here today, because we need to make sure that people really understand the situation, really understand that these vaccines have been proven safe and effective, but also if they have questions, we need to be able to answer them.
You support the encouragement, the renewed encouragement for people, even the vaccinated, to go back to wearing masks?
Oh, absolutely. And I will say this, that we know that any public health response requires a collective response, right? And so right now we're seeing that even vaccinated people can possibly transmit infection. They may not get sick, but they could possibly transmit infection to unvaccinated people. Everyone needs to mask up, right?
Yeah.
Until we get to the point where enough people are vaccinated. We are not there yet. So we need to make sure we're using these other mitigation strategies. These other layers are also important: masking, testing, physically distancing, ventilation. We have to remember that there are many different layers to decreasing the risk for transmission of this virus.
It seems like, there was a big rush. Everybody got vaccinated in the beginning. And everybody else said, well, everybody else is vaccinated, so I don't have to get vaccinated. But that is what still makes us susceptible, right?
Especially us. We need, our communities have been disproportionately impacted by the pandemic in so many ways, health-wise, economically. And I want to say, yes, that is because of systemic racism. That is because of structural inequities. But the fact is that these vaccines, they also are safe and effective. So there are these multiple truths, right? These truths that, yes, we have been harmed, our communities have been harmed, but also, yes, these vaccines are really one of the tools that are going to help us get out of this pandemic.
More MIP after this message. In fact, you tweeted earlier about what's going on in New York, the $100, the incentives, and how I guess those who have responded have been disproportionately New Yorkers of color.
Right. Yeah. And New Yorkers of color, they're more than twice as likely to live in poverty as white New Yorkers. So this should be as no surprise to us, right? So what we ultimately have to do is make sure we're taking care of our communities, making sure that people have access to free healthcare, making sure that people have paid sick leave, right? That they have financial assistance to cover their rent, right? We need to have a holistic view of how we take care of our communities. Yeah,
very important. Lastly, so is there another variant now? Lambda? Is that what I'm hearing?
Yeah, so there's a Lambda variant, yes, but it's still classified as a variant of interest. And it originated in South America, in Peru. It's been around actually at first for months, mostly in South America. But right now, we don't have any real life or clinical data indication that it is going to be a variant of concern. So it's being monitored, which is why it's so important that people get tested so that we can do genomic surveillance. So we know what variants are out there and being accounted for.
Indeed. You're doing excellent work, Doctor. We all are very proud of you. You represent us so well. And we need your voice in all of these conversations. So we thank you for joining us today, okay?
Thank you. Thank you so much. Thank you for having me.
All right. Take care now. All right.
Okay.
Bye-bye.
Bye-bye.
Bye-bye. Thanks for getting woke and listening to Make It Plain. Please remember to listen, like, and wherever you get your podcasts, please give the show a 5-star rating. And please do spread the word. Let's all continue to pray for each other during this pandemic and this police-demic. If all hearts and minds are clear, it has been made plain.